operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. And we have a very timely show tonight because we're going to talk about the 5 common behaviors of sexual predators. As you know, in the news lately, that's been the story, more tied into Summer Olympics, but definitely a story that's hit home, whether, you know, you're a gymnast, a woman athlete, a mother, a father, a daughter, a brother. I mean, I think that's just totally hit, you know, the United States, and a lot going on even in the world of sports. I know there was an emotional night the other night with the Michigan State Spartans because they are very tied to the gymnast program. I should say the United States Olympic gymnast program. So we're definitely going to get more into the psychology behind the 5 common behaviors of sexual predators. And I think that's definitely a good thing for everyone to know, man or woman, Absolutely. You know, old or young, just to know what to kind of watch out for. So my guest, and I want to thank her for coming back to the program, is Dr. Rhonda Freeman. Dr. Freeman, welcome back to the program, and how are you doing tonight?
I'm great. Thank you for having me.
Thank you, and thank you for driving north to the studio here in Boca. I know this time of the year can be a little tough with the traffic, but you were a trooper and we're here early, and I really appreciate that. So yeah, definitely you're a Ph.D. and a licensed psychologist. Yeah. But you put out a very important piece in I actually read it in It's Psychology Today. It's a magazine obviously for psychology, and it was on the 5 common behaviors of sexual predators. Is that, are you a contributing writer for Psychology Today then?
Yes, I'm a contributor for a couple of years now.
Oh, nice. Yeah. I've seen you write, you've done a lot of writing in a few different places. Mm-hmm. That's really neat. Yeah. You know, and you know, writing's close to my heart. Know. That's why I've done a lot of writing, but I really enjoy it. But let's get right into it. So this is definitely a timely subject. Obviously, yes. Larry Nassar was the doctor associated with actually, well, he did. He treated the United States Olympic gymnasts and athletes in the United States gymnast program. Right. And obviously, a lot of info's come out. And one of the things you were able to do is take the 5 common behaviors of sexual predators, right, and kind of explain it a little bit to us. So let's start right out. So what are those 5 common behaviors? I have them listed here, but I want to hear them from your point of view. Let's start with the first one, and how does it work?
Right. Well, most predators engage in grooming, and grooming is how they get the trust from their target. If there's a predator, there's going to be a target. And so they look for a way to access that target. So they'll provide them gifts or attention, time, special understanding, just so that they can form that relationship. the relationship is meaningless to them, but the person who's being groomed actually thinks they're developing something real and close, but it's truly not.
So it's like it's a trick by the predator.
Trick. Absolutely a trick. Yeah.
And so let's go into the maybe the mind of the doctor here, who was charged with these crimes. Yeah, grooming, because he used his medical status of being a doctor to gain access to his victims.
Yes, he did.
And then he had that integrity of being a doctor, so that already gave him a whole nother level. It's not like he was a trainer or someone, cleaning up the gym. I mean, he was someone that actually the gymnast looked up to, and he actually had the ability to touch his patients.
Exactly. Yeah. Being a doctor, he had exactly a right to touch them.
Yeah. Which gave him a whole nother, the access.
Yeah.
And some of the stories I read were just fascinating about.
Heartbreaking.
Heartbreaking. I don't know if fascinating is the word, but I mean in a surprised way.
Yeah.
Like the mom was in the room while he was abusing the child, is one of them I read. And so grooming is definitely, would you say, a disguise he used for medical care then? It sounds like in some of these cases.
Well, grooming, not so much when he gave the medical service, because at that point he had access, he had their trust.
Okay.
Grooming is more about establishing the relationship so that the person lets their guard down and say, oh, this is somebody who I can trust and rely on, and this person wouldn't hurt me. So he gets put in a box of being safe when in fact he's not safe.
I see.
And the part about using his role as a doctor, it plays on our bias to respect status, respect intelligence, respect positions, and so we naturally give them this extra respect and integrity because of that job, when in fact they're hiding behind their job.
And being a person of power obviously helps out if you come up with this kind of, I guess, I don't know if the word's plan, I don't know how they think, because obviously I'm not a sexual predator, but I really think that it has a lot to do with power, and then maybe you'll tell us a little bit too, maybe can be something that happened early on in life. Maybe he was denied. I mean, we don't have this whole denial.
I don't know with him at all. Yeah, it's tough because some of these individuals, they have kind of a genetic predisposition because they have certain personality disorders, and so it can be really tough to peg the why, especially for Nasser, because I have no idea.
Okay, I've heard that before about serial killers as well. So it can be a genetic predisposition?
Yes.
Okay.
Like, for example, for psychopathy.
Okay.
Many of them are born rather than made because of,
Okay, so that's true, and that's been studied, researched.
Exactly.
I never knew this, so I learned something new tonight. Let's get into the second behavior, which is manipulation. Tell us a little bit about how abusers use manipulation to gain access.
It's a great deal of manipulation going on. Grooming is one type, but then they also use what's called gaslighting. So let's say that their victim says, he touched me. They will deny the event happened, or they'll try to reframe the event in the victim's mind and say, no, I was just providing a service, or that didn't really happen. And so gaslighting, for example, is a type of manipulation where it makes the person think that they're going crazy, that what really happened didn't happen. So
it's like almost like a reverse psychology in a way.
A little bit like denying reality. Like they will deny reality or outright lie. Or try to change reality, say something happened that didn't, or something did not happen that did. So it's such a callous form of manipulation because the person is intentionally trying to make the person feel confused.
And the victim maybe second guesses themselves?
Yeah, often the victim will second guess themselves and think, well, maybe he didn't intend to do that. Maybe it was an accident, or maybe I'm seeing this wrong. Maybe I'm being too sensitive. You start to give them benefit of the doubt when they get in your mind and make you think that didn't really happen.
And that destroys confidence, I imagine, early on for the victim as well.
Yes.
Which, with young women, and image and wanting to look great. And I know this sport, I really think out of all the sports I've ever watched in my life, I really think there's some of the most talented and amazing athletes in the world our gymnasts. I love the Summer Olympics. I'm loving what's going on right now too.
I agree with you.
I mean,
though,
it's an awesome
Gymnasts
Olympics
are
so
my favorite
far.
too. Yeah.
But yeah, there's nothing like. I really love the floor exercise. I think it's just amazing. So now, but what I was getting to at that age, it's not only athletic prowess. I don't know if prowess is the right word, but athletic ability. But it's also that look. I mean, these women from young women from around the world, they are their hair's perfect, makeup, everything. So there's a lot of image going on, and to lose that confidence and second guess yourself that there's already something going on there. So
and the betrayal of trust is horrible. Because you trusted this individual in their mind, in your mind, rather they're your friend. You can rely on them; they're okay, and then they betray you, and it can be so destroying for your psychological well-being.
Because this is, I mean, like we said, we don't have all the details. We saw bits and pieces of the trial. You're very busy as a doctor. We're all very busy in our lives nowadays. But one of the things that maybe went on with Dr. Nasser is this was maybe planned out over time. Maybe when he first met the victim, he already had a plan in his mind, and maybe those few times he was gaining access and building confidence, the victim having confidence in him is what I'm saying. Yeah. So it may have been planned out because premeditated is what I'm thinking.
Right. Well, grooming has to be premeditated.
Okay.
Yeah, absolutely. So no matter what, he had to premeditate. If he provided them gifts or candy, I think that one of the victims says that he gave treats when they really weren't allowed to have treats. And so that's a part of the grooming process of, see, I'm your friend. I help you. I make you feel good. And he knows later on, though, that he's going to violate that trust.
Wow. We're here with Dr. Rhonda Freeman, and she's a licensed psychologist and a neuropsychologist as well. And you can find out more about her, RhondaFreemanPhD.com. Just type that into the search bar, 954-437-4000. And there's a ton of information. You have a great website. I always tell you that because it's very accessible. And you do a lot of research, I know, as well, and you do a lot of writing. So there's a ton of sources there. We're talking about the 5 common behaviors of sexual predators. Let's get into number 3 before, I think we have a couple minutes before a break. Okay. And I know this is something that you probably are the biggest expert about because you're a neuropsychologist, and this is cognitive distortions. What is that?
Yeah, it's a belief system, and it's also erroneous thought processing. So we see this really commonly with predators and child molesters. They will have a belief that makes their behavior okay to engage in. So one of the beliefs that many molesters have is that, well, children are sexual beings and it's not harmful to have sex with children. And therefore, their mind gives them permission. Well, it's okay that I do this. So they match up their sexual desire with their cognitive beliefs, which is distorted. And so when they engage in sex with kids, they really don't think it's a big deal. Like, I don't understand why everybody is thinking this is harmful, this is natural. And it lets them off the hook for really bad behavior.
Wow, that is just something else. And then in the belief system, like you said, and to just think it was a doctor, but like you said early on, this could be a genetic predisposition.
We don't know.
He was able to hide this for a very long time, and it could not only be going on, doesn't have to be, could be going on any walk of life.
Absolutely.
I mean,
anybody.
Yeah, definitely. Well, let's take a quick break, and on the other side, we're going to come back and talk about victim reversal, lack of empathy, guilt, and contrition on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to You and Your Doctor Show. We're here with Dr. Rhonda Freeman, Ph.D., and she is a neuropsychologist and a licensed psychologist. And we're talking today about the 5 common behaviors of sexual predators. We talked a little bit about grooming, which is number 1, manipulation is number 2, and then a subset of that manipulation is gaslighting, which Dr. Freeman was just telling me is all over the news today. I mean, just Google it and you'll see it's been to the White House and back today. So that's the number 2 common behavior. Number 3, cognitive distortions we left at. Yeah. Let's get into number 4 and 5 so we can talk a little bit more about this as well. So number 4, victim reversal. What exactly is that?
I don't know if that's a real term. I made that up
Okay.
as far as the term. However, it does refer to a very common behavior. Some people might call it scapegoating, but I think it's a tad bit different from scapegoating because victim reversal, they focus on how good they are. Mm-hmm. They want you to remember their good traits and their value, and so they want to tell you that they're successful in their job, or look at what happened to me. I shouldn't receive such a harsh penalty. What I did wasn't that bad. So they're looking to put themselves in more of a positive light than actually accept the consequences of this really bad, shameful behavior. So they won't speak too much about the victims or the people they hurt, but they'll speak about their goodness. Mm-hmm. This is slanderous to me. This is hurtful to my career. But they won't mention that, they hurt people who are suffering, and they won't address that.
Now, in the trial with Larry Nassar, the charged doctor with the United States gymnast who was just charged with sexual abuse. I don't even know how many charges. It's hard to keep up with all the facts. Now, one of the things he did early on was victim reversal.
Can you tell me, because I didn't see that?
Yeah, he pretty much early on, he would always, when they asked him certain questions, when he was on the stand, he would always reverse it and talk about what a great doctor he was, what kind of care he was providing. Yeah. The reason that they were so successful was because this expert care that he was providing, that kind of thing. So early on, but as the trial wore on and the judge let a lot of the victims talk to him directly, it started to wear him down a little bit, I noticed. Good. I don't know if that was the judge's, goal. Mm-hmm. Or how that works, but it definitely over time, because at first he was completely reversing it, and he totally, was very manipulative at first early on. He definitely had the cognitive distortions that we were talking about, because he didn't seem, upset at all that he had been caught. It was like, why am I here, kind of thing. Mm-hmm. So it was early on I noticed that. Now, number 5, and then I want to go back to 4 in a second.
Sure.
Tell us a little bit of that. It's lack of empathy, guilt, and contrition.
Yeah. Like when it's like a more of a step from just an apology. It's more than saying I'm sorry, but showing that you're sorry and trying your best to make up for it in some kind of way. And so, so when an abuser or somebody with this type of style give an apology, it tends to be hollow. Mm-hmm. Because they really don't mean it. They don't like getting caught, but they really don't have the capacity to feel badly for their victims. If they were to feel really badly, they can stop, they would not do the behavior over and over and over again, even though that behavior is addictive, though, for them. So they have a hard time stopping without someone stopping them. But as far as really feeling badly for it, their cognitive distortions help them not feel badly for it because they have a belief system that says this is okay. And some of them, especially if they're psychopaths, don't have proper emotional processing abilities in their brain. So the system that handles guilt, remorse, morality doesn't work properly. So they can't feel guilty for anything they do. So if there's an apology, it will not be sincere, genuine. It can't be.
And Dr. Nasser, he really fits these to a T. He's like the perfect case study for 5 signs of common sexual abusers. I mean, he had lack of empathy right from the start.
Yes.
Even at the end, I know he cried a little at the end. There's speculation if that had a lot to do with it because it was close to sentencing or not. Mm-hmm. But he definitely, early on, lack of empathy, I think, almost laughed it off in a way.
Yeah. Sure.
Yeah. And that was, like you said, because of his cognitive distortions, his belief system, as well. And I want to go back to number 4 again, because this is definitely in the news, victim reversal, and this kind of goes into gaslighting as well. Another way abusers make things seem part of normalcy is victim reversals. And that's timely because we saw recently the president, Donald Trump, tweeting, saying the women who claimed Rob Porter violently abused them. Obviously, it is, you're innocent until proven guilty, definitely.
Right.
But there's a lot pointing that something may have been there as well as photos as well. And then the president tweeting about giving false allegations. And to remember, Rob Porter was saying he's innocent. America needs to take that into account, which is definitely right.
Sure.
But and then another White House aide came out that they may be an abuser as well, and it seemed like the president was kind of, remember these guys, did a fantastic job for me when they worked here and this and that.
Yeah.
He didn't really talk about the women who were abused.
Right.
So that's kind of gaslighting in a way and victim reversal.
Yeah,
my opinion. Definitely.
It's a sad that there are some in our society who continue to kind of blame the victim and make the victim prove that they were harmed, but it's really difficult to come out if you're an abuser and say this happened to me. Nobody wants to be the victim of abuse. Nobody. So to say that there's got to be some truth to it, I feel, but I'm always one who's apt to believe the victim, just because I know how difficult it is to come out and say, especially regarding somebody powerful, that they harmed you.
Because there's a lot that goes along with that.
A lot of consequences for that, so, yeah.
The more power they have, the more the probably ways they can ruin your life.
Absolutely, absolutely.
More than one, for sure. Yeah, I found that interesting too, and I'll tell you, sure, there is a possibility that some of these accusations possibly, and I say that say it a kind of accent is the word I'm saying, possibly, because I really think that there's a very small percentage that some of these that if they weren't true, I really believe that most of them are probably true. So that's interesting. That's in the news right now, gaslighting. And then you were telling me, Google Anderson Cooper, and there it is. Sarah Huckabee Sanders, the press secretary, comes up about how she's kind of had to defend some of the comments as well. Now, let's get into a little bit about the men and women who have been hurt by sexual abuse. What words of advice do you have for them? And this really hit me to heart because it was a guy recently came out, the country singer Vince Gill. He recently came out and he had a song. It said he had to run away running away from school when he was 7th grade. No one knew about this, but apparently a man tried to sexually assault him. I believe it was someone in a power role, a teacher, possibly. And he actually wrote a song about this. I think he's 61 years old and he's just telling people about this. So what words of advice do you have for men and women hurt by sexual abuse?
First off, definitely sorry that this happened, because this is one of the worst ways to be violated. And the advice I would give is to definitely get help if you notice some symptoms, because our brain reacts to everything. And when it gets violated or there's a threat of violation, it has a response. And sometimes that response can create trauma symptoms. So depression, anxiety, trouble sleeping, the thoughts just pop back in your head all of a sudden and you're not, even thinking about the situation. PTSD can happen, and all those things are treatable, but they will linger for years if you don't get them treated. And so hence somebody who is in their 60s can still feel that very deeply, even though it happened when they were perhaps 14 years old.
Still in there.
It's still in there. Yeah, the brain just keeps it until it's able to go through the proper process of healing.
Now, in your practice, do you, with licensed psychology, I guess would be the right term, do you provide testing and cognitive and treatment for sexual people who've been abused by sexual abuse?
No. At Sunrise Medical Group, I'm solely a neuropsychologist that does testing.
Okay.
I just have such a strong level of compassion for people who have been abused and violated, because that is in my background. And so I kind of took this on as a mission, and I feel that I just want to, as much as I can, help people who are in these situations understand what's happening. And so outside of work with Sunrise Medical, I also help victims of abuse through online information.
Oh, okay.
Yeah.
And people can go and get that information at your website?
Right. It's not the Rhonda Freeman website. It's called Neuro Instincts, but there's a link at the Rhonda Freeman Ph.D. Website that they can go to.
Okay, to Neuro Instincts as well.
Yeah. And that's where I talk about
Excuse me.
abusers. It's okay. Abusers and the symptoms that a lot of victims experience. Because one of the things I think with society, and society is getting a lot sharper now, thankfully, is that, when somebody who's very powerful is abusive, it's almost like, well, the two things can't exist at the same time. You can't be an abuser and very powerful. But what I'm trying to help people understand is that the brain systems that handles our intellect, our education, our academic success, our occupational success are completely different, for the most part, from the systems that handle our impulse control, our desires, our morality. Those systems of the brains are very different. So you can be amazing in your career, however, have very poor morals. You can violate people, animals, children, and yet go to work and be a CEO of a company. Because it's the brain systems that handle one is not the systems that handle another. So they can exist in the same person. You can actually have respect for your abuser because they are so amazing at their job.
That is so true. Yeah. We saw that recently with what started the Me Too movement in a way out in Hollywood.
Yeah, that's right. What's his Weinstein?
The movie producer.
Yeah.
I produced one of my favorite movies of all time, Pulp Fiction.
Yeah.
I knew as soon as his name came out, I knew exactly who he was. So when I was younger, I was a big Quentin Tarantino fan.
Yeah, he's good.
And that's the guy who funded all Quentin Tarantino's movies.
Wow.
And Quentin even came out right away and said, hey, I had heard some of these stories, but, he was the producer. He's in a power position. What am I going to say? He cut money for my movie. Yeah. And the same thing happened, obviously, at the Today Show. Matt Lauer.
That's right, yeah.
No one saw that.
Yeah.
But there's been a lot to come out on that recently as well. And that kind of started the whole movement. And it's, it's great that people now have a voice, whether it's because of social media or whatever other reasons. But it's really moved in the direction. And I don't know if there wasn't a Me Too movement if this whole thing would have came out about USA Gymnastics, because now that's coming out that's was hidden for a little while as well. I mean, I know the president of Michigan State University had to step down because of it, because it was tied into it. Mm-hmm. And like I said, the game I was watching the other night, the men's basketball coach was crying about how tough a week it was, and I've always respected him. He's really a good guy, Tom Izzo, but apparently, they had checked him out, and it just it really brought down that whole community. And I actually love that state, Michigan. I got a lot of friends and family from there, so I hated to see it was happening in Michigan. But it could happen anywhere in the world. But thank you for coming on the program and talking about such a timely topic. I know it's a tough topic to kind of bring up, sexual abuse in general, but thank you for writing about it and doing so much with Psychology Today. Definitely take the time to look up Dr. Rhonda Freeman. I'll give out your website again, RhondaFreemanPhD.com, and the phone number 954-437-4000. And you said from there they can get to the Neuro Instinct page.
Yep. There's a little tag there. Yep.
And thank you for doing this as your passion. Definitely.
You're welcome.
And I gotta also congratulate you. I know the Philadelphia Eagles won the Super Bowl. And did you study in Philadelphia to start out? You went to Drexel, right?
Yeah, I went to Drexel.
Wow.
Actually, I got my master's, my bachelor's, master's, and PhD at Drexel, the same school.
Are you from the Philadelphia area?
I was born in South Carolina, but most of my life I spent in Philly.
Oh, okay.
Yep.
Neat. I have yet to get to Philadelphia. It's always been on my list because of the history.
Yeah.
And obviously the cheesesteaks.
Yes.
The Geno's versus the other one, I don't even know.
Pats.
But is it Pats? Okay. Yeah. Which is better?
I don't like either.
No, you don't look like you eat a lot of cheesesteaks.
Shops.
No, I know. Yeah. And I was watching a lot on the celebration. I was so happy that someone else won Super Bowl. I mean, it was a great Super Bowl. It could have went either way. Mm-hmm. I'm a Dolphins fan, but just watching the celebration on, I guess the main thoroughfare there is Broad Street.
Broad Street, that's right.
Yeah.
Yep.
Now, you were a Philadelphia Eagles cheerleader when you were at Drexel?
Yeah.
Or after?
No, during Drexel, yeah.
And how many years?
4 years. Mm-hmm.
4 years. Mm-hmm. Wow.
Yep.
What was that experience like?
It was great. I loved it.
Were you there the last time Philadelphia went to the Super Bowl with Donovan McNabb? No?
Mm-mm. No, when I was there, my last year was Donovan McNabb's first year.
Okay.
Yeah, so it was a long time ago.
Did I see a picture of you and Donovan McNabb?
Uh-huh.
Man, he looked great, but he looked very young. He does not look like that anymore.
He looks like a baby, right?
He definitely, those NFL years really took a toll on him. Well, quarterbacks, they take a lot of physical abuse and probably
head
cognitive as well. Yeah. I know you do a lot with concussions as well, so.
Yeah, now that is something that I do, exactly, at Sunrise Medical Group, is evaluate concussions, brain trauma. Mm-hmm.
Now, and I have to also mention, you were also Miami Dolphins cheerleader for 1 year?
Yeah, just 1 year.
Okay.
Yeah, that was a little tougher to do when you are actual neuropsychologist, so
yeah.
I could only do 1 year, yeah.
Nice. What year was that?
Oh, gosh. 06, 07.
06, 07.
Yeah.
What brought you to South Florida?
University of Miami.
Okay.
I did my fellowship here, so once I got my Ph.D., then you have to do a year of training afterwards, and so I went to UM.
These are really prestigious schools. Wow, Drexel, University of Miami. Wow.
Yeah, I love UM.
I've seen your resume a few times, and I just missed the UM part. We have a lot of great doctors from UM.
We sure do. Yep.
Did you do some education and training, I guess, at Jackson Memorial Hospital then? Is that how it works?
Exactly, yep, at Jackson.
Which is a huge hospital.
It's big, yeah.
I know we had a chief medical officer on the program recently from Jackson.
Oh.
I think they were telling me, is it 1,200 beds? It's that big?
I don't know, probably.
No. Yeah, that's probably 3 times the size of Florida Medical Center, which I think is a huge hospital in my opinion. That's like Delray Medical Center's pretty big, 400 beds or more. I may be wrong, but wow, I didn't know that. Yep. That's I learn something new every night. Well, thank you so much for coming on the program again.
Thanks for having me.
Yeah, and you're always welcome. I think this has been like the 3rd or 4th time you've been on. So it's Rhonda Freeman, Ph.D.com, 954-437-4000, and we'll be right back on the You and Your Doctor show. Living a longer and healthier life show.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Back on the You and Your Doctor show, and as well, hashtag living a longer and healthier life. And I just had a great discussion with Dr. Rhonda Freeman, the neuropsychologist, about the 5 common behaviors of sexual predators. And I just want to thank again Dr. Freeman for coming to the program. And also, I will say this isn't a political show. I am an independent, and we talk a little bit about the president there and his tweets, but who isn't talking about the president and his tweets? So, I just wanted to put that out there. But second half of the show, we're going to get into a topic which we talk a lot about on this program, which is COPD, but actually respiratory therapy in general and patient's choice and what's going on with the patient. So you'll remember from the program, Ed Salazar, head respiratory therapist at All County Healthcare. Ed, welcome back to the program, and thank you for, coming back on such short notice. I really appreciate it.
It's a pleasure to be here again, Dave.
I want to ask you one question. I know we're going to talk about patient choice, but I want to ask you that question I think every hospital in the United States could use a little info on. I've been watching those stock prices go down for hospital groups, and how can they help reduce readmissions? Because I believe we talked a little bit about this in the past. Hospitals want to get people in and out of the medical center or hospital because they have to.
Well, the issue is that CMS has taken the position that when there are recurrent readmissions for the same diagnosis, and I believe the standard they use is 30 days. If a patient is discharged and then readmitted within 30 days for the same diagnosis, then a penalty is going to be issued to the hospital on their reimbursement. So, huge concern. The only statistics that I have knowledge of myself are, with COPD, pneumonia, things like that. And in the last statistical period, I think it runs from spring of 2016 to the spring of 2017, there were a total of about 68,000 admissions across the state of Florida for exacerbation of COPD. And the thing that is disturbing is that about 9.25% of these patients, so 9% of that 68,000 were readmitted back into the hospital within 15 days of discharge. This is a huge number. and it's an enormous amount of money. So at All County, we've been working very, very hard with hospital groups to develop a transitional care program for, this being one of the most prevalent chronic disease issues, COPD. All County is the only Medicare home health agency that owns the IPV devices, that they have that technology. I've taught at least a dozen of their nurses to give the therapy safely and efficiently in the patient's own home. And the outcomes have been remarkable. What's encouraging is that we are getting more and more hospitals that are starting to use the equipment in the hospital. So that makes the transition, easier. Once they go home, they can just continue with that same therapy.
I know we talked about this IPV device before, but that's the acronym. So it's an intrapulmonary percussive ventilator. And what does that do?
What it is, it's a real powerful aerosol generator. Anybody with a chronic lung condition, is probably familiar with different aerosols, that are used to treat their condition. With COPD patients, they commonly get drugs to dilate the airways, steroids to fight the inflammation, things to help mobilize secretions. But a lot of these patients with a higher acuity lose the ability to mobilize these secretions effectively. So the drugs are introduced in an aerosol form in hopes that that they can facilitate this. What intrapulmonary percussive ventilation does is it incorporates physical medicine, internal percussion of the airways all the way down to the terminal lung units, the alveoli, and it mobilizes these secretions. Patients, whether they've got an effective cough or not, they'll still mobilize these secretions, and that's what makes it such a beneficial therapy for these patients.
Is it for the common person? Is it can you say it kind of breaks up that mucus? And you said that makes it a cough that is I'm out of
well,
words there.
Here's a good analogy. To say it breaks it up is one thing, but imagine if you could set up a pneumatic escalator.
Okay.
So you've got air going into the airways at 150 to 600 cycles per minute. Little puffs of air. Very, very low pressure. So there's no chance of barotrauma from this. But you've got this very, very high frequency of little puffs of air going into the patient's lungs, along with, their spontaneous respiration. Now, when these little puffs of air get to the end of the line, it's got to come back out again. And when it comes back out, that's when it transports the mucus with it.
Oh, I see. Okay.
And it works. I mean, there's nothing new about this. This technology has been around for at least 30 years, What is relatively new is the platform which the manufacturer, Percussionaire, they developed this platform that makes it practical to use it outside of hospitals because it has a self-contained 50 psi compressor.
Oh,
and
nice.
This is the equipment that All County brings to patients' homes.
And COPD, I was reading, is, I believe, the third largest cause of death in the U.S., so this is nothing to joke around about COPD. I mean, people got to get out of the hospital and stay out of the hospital. No more hospital readmissions because it's a life and death situation. I mean, third leading cause of death in the U.S.? I can't believe that. It's something we know really little about. I mean, the common population I'm talking about. Obviously, you do. It's
well, it doesn't get enough attention. If you go to the National Health Institute website and you do a search for the amount of money spent for research on different disease conditions, although COPD, as you said, is number 3, but we're going to talk about that a little bit too. But as far as the CDC is concerned, I think it's number 3. Yet, far less money is spent on research for COPD than some of these other conditions, chronic conditions that, just seem to get more airplay.
Yeah, that's something. Got to change that. Yeah.
But what we were saying about, according to who does the research, a study that's become very popularized that was done, I think the initial work was done at Johns Hopkins, shows that medical errors is now the third leading cause of death in the United States.
Okay, you're right. I think COPD today was fourth. I was trying to find it's third or fourth.
And that's another story. That's another tragedy in itself.
Yeah, unfortunately. Now, let's talk a little bit about something you're passionate about today, patient choice. What actually is that? It sounds kind of easy to explain, but I know there's a lot more going on there.
Well, here's what brought it home to me. Recently, my brother was in a area hospital, and it's a large hospital system that they have their own home health agency. Now, when it came time for him to be discharged, the caseworkers come in and they say, well, the agency that we like to use, that we trust, that we have the best relationship with, and then they give the name of the agency, which just happened to be the one that was owned by their healthcare system.
It's funny how that happens.
I'm sure it was just a coincidence. But there are virtually every large hospital system, at least in South Florida that I know of, has their own Medicare home health agency. But the caseworkers are obligated to give the patient a list of qualifying Medicare home health agencies so that they can make a choice.
Yeah, a list of choices, whether it's one from their health system and then one independent of their health system. There should be a list there. Mm-hmm. That's the ideal situation, patient choice.
Well, my brother said, he wanted to use all county, but he had to specify twice that it was all county that he wanted. And then it was granted. I mean, they were contacted. But clearly there was a partiality toward where the caseworker would have preferred the patient went. And the reason it means so much to me is if you have a patient that has just recovered from an exacerbation of COPD, your listeners, the audience that is listening to this program, they know now that there is a Medicare home health agency that specializes in this. We have a true pulmonary hygiene team, that not only has the personnel, but we have the interventions, the actual equipment to make a difference and keep them out of the hospital. But it's a choice that the patient has to make at the time that they're discharged from the hospital.
I see. That's what patient choice is.
Yes.
Thanks for explaining that, because I know it is very important. And I know about your respiratory hygiene team because I did a little look on the website the last few times. I think this is your third time being on the program with me, so thanks for bringing all that info. But I think I saw a picture on the website, but then there's a ton of information on the website about everything that All County Healthcare does for respiratory therapy.
Well,
and you mentioned early on in this program you trained 12 nurses at least with them.
Correct.
That's fantastic.
And they do wonderful work. They do wonderful work. But I can also tell you from personal experience that I have a family member that received wound care treatments from them, and excellent, outstanding. My wife, who had been the director of nurses for this agency, she lost her battle to cancer about a year and a half ago, but the time that she was going through her chemotherapy and all her other issues, All County could not have done better by her. So it's not just COPD. They are a wonderful full service home health agency.
And in all three counties, Tri-County area?
Yes, sir. They're licensed in Dade, Broward, and West Palm Beach.
Oh, that's fantastic. Because that's important nowadays, because we have family and friends all across the Tri-County area. Now, All County Healthcare, and you're the head respiratory therapist. I'll introduce you again, Ed Salazar, head respiratory therapist at All County Healthcare. You can see all the info at allcountyhealthcare.com. Or if you ever want to see this radio show, you kind of remembered something and want to go back, you can always go on the allcountyhealthcare.com website, and there's a actual tab there, radio shows. You'll see my smiling face there, along with Ed, and you can click right on there. Or now with Facebook, All County Healthcare INC, type that into the search bar, and you can see any of the videos. But I was amazed at all the respiratory therapy treatments on the website. The vest airway clearance therapy, respiratory medicinal teaching. I think that's probably goes along with the nurses that you were talking about as well. Oxygen therapy education, that's important because we see those oxygen canisters clinking around, but obviously there's a safety aspect to that as well, and to be able to get the oxygen into your lungs correctly. Breathing exercise education, that's important for people.
Oh, sure. There are a lot of different techniques. There are a lot of different methods that can be used to help people suffering from COPD improve their quality of life. One of the scales that is commonly used is ADL, Activities of Daily Living, and when the nurses go in and do their initial assessment, they'll try to determine how effectively these patients can do these simple things for themselves. And then this will kind of dictate what ancillary services the patient might need. Clearly, if it's someone with a chronic lung issue, we would like to, and they've had a recent, a discharge from hospital for an exacerbation, we would like them to use the IPV to prevent that. But, there are many, many other things that occupational therapy can do for these patients, that physical therapy can do for these patients to improve their quality of life.
Yeah, I didn't realize how much, therapy is involved until recently. I had a family member over the last few years who had, a few it was like a surgery every year. And, yeah, the doctor, they do their specialty and treating whatever the ailment is, and then you got to have a great therapy team. And you said occupational therapy, physical therapy. I mean, my family member had surgery, and I think she had both of those and a respiratory therapist at one point. And that's really the healing that is done by those three main, medical specialties. Now, I saw also, and you mentioned it before, chest physiotherapy. That's something you do as well. That's kind of with the IPV. Right. Right under that's a subset of that. I just want to mention these as well because I know you're going to tell us a little bit about some new news as well. Ventilator management education, definitely important. Tracheotomy care and training. I actually saw it was on a TV show last night about a tracheotomy. So that is very timely as well. And nebulizer equipment medication education is something that your respiratory hygiene team can help with as well. So I know you wanted to share some other news in respiratory therapy today. So just let me, we'll go there now.
Well, something that happened recently that I was very happy about. We got a call. I don't know how they got our name, but it was up in Ocala, and we got a call. A gentleman had been riding a Scorpion, like the three-wheeled motorcycle.
Oh, okay, yeah, I've seen them. And I haven't ridden one, but I've seen it.
And this fellow was, I think he's probably 70 years old, but he'd been riding motorcycles all his life, so it wasn't like he was out a novice doing something he shouldn't have been involved in. But he literally got ran into a brick wall. So, a young man in a pickup truck ran him off the road and left the scene. As a consequence of the crash, this man had very, very severe lung contusions. Long story short, the local hospital was having a very, very difficult time weaning him off the ventilator. He needed mechanical ventilatory support. So they sent him to an Avante facility in Ocala that has a ventilator unit and, a rehabilitation program. And we have those types of programs here in South Florida as well. They were having difficulty, weaning him off the ventilator. And a doctor suggested to the family that, maybe you would want to look at IPV. That. Long story short, we got up there.
You went up to Ocala?
Yeah.
Wow.
Yeah.
Road trip.
Road trip, right. Beautiful city.
I've heard that. I got to do that.
Spent a couple days there, got the therapist up to speed, and he not only got weaned off the ventilator, he got decannulated, and they're sure he'll be discharged with a full recovery.
That's a fantastic story and great news. I'm glad he could connect with you. And definitely, if you have any questions about home health or Medicare certified agency right here in our backyard, allcountyhealthcare.com, 1-888-717-7170, or on Facebook, All County Healthcare, INC. Ed Salazar, thank you again for coming on the program and talking to us about respiratory therapy.
My pleasure.
Really appreciate it. You're always welcome on the You and Your Doctor and Living a Longer and Healthier Life show.
Thank you, Dave.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers.